Hey guys, it's DRR and welcome back to my channel. Today we're diving into a topic that's incredibly important for everyone to understand. HIV testing. HIV, or the human immunodeficiency virus, attacks the immune system, making it harder for your body to fight off infections. If left untreated, it can progress to AIDS, a more serious stage of the infection. Early detection and treatment can drastically change the course of HIV and help people live long and healthy lives. In this video, we'll break down the different types of HIV tests available, how they work, and why getting tested is so important. Let's start with the most common type of HIV test, the antibody test. Your immune system is like your body's defense team, always on the lookout for harmful invaders like viruses and bacteria. When HIV enters the body, your immune system releases special proteins called antibodies to fight it off. Antibody tests work by detecting the presence of these HIV-specific antibodies in your blood or saliva. Think of it like a search party looking for clues. If they find HIV antibodies, it means you've been exposed to the virus. Some tests are designed for rapid screening and can give you results in as little as 20 minutes. These are great for quick checks, but a positive rapid test always needs to be confirmed with a more sensitive lab test. Other antibody tests are performed in a lab setting and are considered more accurate. These tests might take a bit longer to get results, but they provide a higher level of confidence in the diagnosis. The great thing about antibody tests is that they're widely available, relatively inexpensive, and pretty easy to perform. But remember, timing is key when it comes to antibody tests. It takes time for your body to produce enough antibodies for the test to detect. This is called the window period, which can range from a few weeks to a few months after infection. During this window period, you could still have HIV and be able to transmit it to others even if the antibody test comes back negative. That's why it's so important to talk to your doctor about your risk factors and get tested at the right time. Let's talk about ELISA, which stands for Enzyme-Linked Immunosorbent Assay. ELISA is a highly sensitive lab test that's considered the gold standard for HIV antibody testing. Here's how it works. A sample of your blood or saliva is added to a plate that contains HIV proteins. If you have HIV antibodies in your system, they'll bind to these proteins, kind of like puzzle pieces fitting together. Then, a special enzyme is added, and this enzyme triggers a color change if HIV antibodies are present. The intensity of the color change indicates the amount of antibody present. ELISA is incredibly accurate and can detect even very low levels of HIV antibodies. However, like all medical tests, there's always a small chance of false positive or false negative results. That's why if your ELISA test comes back positive, it's always followed up by a confirmatory test called the Western blot. The Western blot is even more specific for HIV antibodies and helps rule out any potential false positives. ELISA has a shorter window period compared to some older antibody tests and can usually detect HIV antibodies within a few weeks of infection. If you're concerned about HIV or think you might have been exposed, talk to your doctor about getting tested. They can help you determine the best testing strategy based on your individual circumstances. In today's fast-paced world, we often want quick results, and that includes HIV testing. That's where rapid HIV tests come in. These tests are designed to provide results in 20 to 30 minutes, making them ideal for point-of-care settings and situations where immediate information is crucial. Rapid HIV tests work by detecting HIV antibodies in your blood or saliva, similar to traditional antibody tests. The difference lies in the technology used. Rapid tests use a simpler method that allows for much faster processing of the sample. There are different types of rapid tests available, some using a finger-prick blood sample, while others use oral fluid collected with a swab. One of the biggest advantages of rapid HIV tests is their accessibility. They can be performed in a variety of settings, including doctors' offices, clinics, and even mobile testing units. This makes it easier for people to get tested, especially those who might face barriers to accessing traditional healthcare services. Getting results quickly can reduce anxiety and uncertainty while allowing individuals to take immediate action if they test positive. However, it's crucial to remember that rapid HIV tests, while highly accurate, are not perfect. Follow up any positive rapid test with a confirmatory lab test such as the ELISA or Western blot to confirm the diagnosis. We live in an age where we can manage so much from the comfort of our own homes, and now, HIV testing is no exception. Home HIV test kits have emerged as a convenient and discreet way for individuals to know their status on their own terms. These kits are designed for self-testing and are available without a prescription in many countries. They typically use a saliva or blood sample, and the results are available within minutes. Home HIV tests offer several advantages. First and foremost, they provide privacy and confidentiality. For some individuals, the stigma surrounding HIV can be a barrier to getting tested in a clinical setting. Home testing eliminates this barrier, allowing people to test in a safe and comfortable environment. Home tests give individuals greater control over their health. They empower people to take charge of their well-being and make informed decisions about their sexual health without having to schedule an appointment or visit a clinic. However, it's essential to use home HIV tests correctly and understand their limitations. A positive result on a home test should always be followed up by a confirmatory test conducted by a healthcare professional. When it comes to HIV testing, early detection is paramount. The sooner we know our status, the sooner we can take action to protect our health and prevent transmission to others. That's where antigen antibody tests, also known as fourth-generation tests, come into play. These tests represent a significant advancement in HIV testing technology. Unlike earlier generations of tests that only detected antibodies, antigen antibody tests can detect both HIV antigens and antibodies. Antigens are foreign substances that trigger an immune response in the body. In the case of HIV, one of the key antigens is a protein called P24, which is part of the virus's structure. Antigen antibody tests are designed to detect both P24 antigen and HIV antibodies in the blood. This dual detection method allows for earlier detection of HIV compared to antibody-only tests. During the early stages of HIV infection, the amount of P24 antigen in the blood is relatively high, even before the body starts producing significant amounts of antibodies. Antigen antibody tests can detect HIV as early as 2 to 4 weeks after infection, significantly shortening the window period compared to older tests. This early detection allows individuals to start treatment sooner, which can help preserve their immune system and prevent the progression of HIV to AIDS. Antigen antibody tests are highly accurate and considered the preferred method for HIV diagnosis in many healthcare settings. In the realm of HIV testing, nucleic acid tests, or NATs, stand out as the most sensitive and advanced option available. These tests work by detecting the actual genetic material of the virus, known as RNA, in the blood. One of the most common types of NATs used for HIV testing is the polymerase chain reaction, or PCR test. PCR is a laboratory technique that amplifies specific DNA or RNA sequences, making it possible to detect even minuscule amounts of viral genetic material. NATs are incredibly powerful tools for HIV diagnosis, especially in specific situations. They are the gold standard for diagnosing acute HIV infection, which refers to the earliest stage of infection when the virus is rapidly replicating in the body. During acute infection, the levels of HIV RNA in the blood are extremely high, making NATs the most reliable method for detection. NATs can detect HIV as early as 10 to 14 days after exposure, significantly earlier than any other type of HIV test. NATs are commonly used for diagnosing HIV in newborns born to HIV-positive mothers. This is because antibodies from the mother can cross the placenta and be present in the baby's blood for up to 18 months, potentially leading to false positive results with antibody-based tests. NATs specifically detect the presence of HIV RNA, providing a more accurate diagnosis in these cases. While NATs offer unparalleled sensitivity and early detection capabilities, they are not routinely used for general HIV screening due to their cost and the need for specialized laboratory equipment and expertise. So there you have it, a breakdown of the different types of HIV tests available. Getting tested for HIV is a crucial step in taking control of your health. It's quick, it's easy, and most importantly, it gives you the information you need to make informed decisions about your well-being. Early detection and treatment are key to living a long and healthy life with HIV. So take that first step, know your status, and remember, you're not alone.